Good evening and thanks for joining us. There's another report from the military tonight on grim conditions inside some Canadian long-term care homes. This one is from Quebec, where soldiers were called in to help in 25 homes overwhelmed by COVID-19. The report is 60 pages long, though not as detailed about the shortcomings as were exposed in Ontario care homes yesterday. It says soldiers witnessed some exceptionally difficult situations, including staffing shortages, problems with PPE, and issues with how residents with COVID-19 are handled. Ontario's Premier Doug Ford today promised swift action to remedy the deplorable conditions found in some homes. He announced more inspections and said the government is taking over management of 5 more of Ontario's hardest-hit facilities.
In the face of these problems, we'll use every tool at our disposal. And that means staying on top of the situation in these homes. We need boots on the ground. I want eyes and ears in the homes that we're most worried about, keeping a close watch.
Right now, soldiers have been the only outside eyes and ears, and advocates for the elderly say what they exposed is terrible but not new. Failings in long-term care, especially inadequate staff and low pay, are long-standing. The pandemic has made pre-existing problems worse. There remain active outbreaks in 199 long-term care homes in Ontario and 131 long-term care homes in Quebec. We'll get to Ontario and demands for accountability in just a moment, but we begin with Mike Armstrong and Quebec's care home crisis.
Soldiers have been working in this Montreal seniors residence for more than a month, and we now know how it's going. According to the report released Wednesday, almost every single day, there's some sort of an incident that disrupts the routine. Now, what that means exactly, we don't know. The military's report into Quebec long-term care facilities is quite different than the one for Ontario. Whereas that one listed incidents, some of them horrifying, the Quebec document is more of a situation report. It gives the staffing and infection rates for each of the 25 residences where soldiers are working, and then has a section for comments. Most of those comments flag issues with communication, management, PPE, and discipline, and a critical shortage of staff. Patients' rights advocates say not much of it is surprising.
There are not enough staff, and anyone who's had a loved one in long-term care will tell you that.
We lack training and we lack supervision. What the military are observing is the result.
The crisis didn't start.
Quebec's premier says he didn't learn much from the report. Most of the problems, he says, are the result of what he calls embarrassing staff shortages that existed before COVID-19, but were made worse by it. The Army was supposed to be a month-and-a-half stopgap, but that gap is still there.
I've asked Mr. Trudeau this morning if we can keep people from the Army until September 15.
Legault says he needs the soldiers in place while new staff is trained. The province is going on a hiring binge with significantly higher wages. New orderlies, for example, would start at close to $50,000 a year. Now, it is also staffing that's being blamed by unions for the awful conditions flagged in the Ontario report. They say workers don't have enough time to give proper care, and they fear for their jobs if they go public with what's going on.
I know that frontline workers want to do more in speaking out for themselves in the conditions, but they live under this reign of terror and fear.
The question now is how these two reports might affect the relationship between soldiers and civilian staff. Could there be resentment that troops are being seen as whistleblowers? Mike Armstrong, Global News, Montreal.
These military reports have exposed failings on many levels. David Akin is looking into accountability tonight. David?
Yeah, well, Donna, let's start with those Ontario facilities that were flagged in that Canadian Forces report. Remember, there are investigations underway, and they will find out if the operators or even some employees violated regulations, perhaps even broke some laws, and there could be some serious consequences. An operator could see their license pulled, there could be fines, maybe even jail time. And as you heard, the Premier has ramped up a surveillance program. This is going to affect not just the 20 homes identified as hotspots, but all homes in Ontario, all 626, with an enhanced inspection routine. And then there's the political accountability. The Premier today saying that an independent commission is going to get underway in July, and that commission is going to have the power to compel testimony from the Premier and anyone in Cabinet. Sounds very much to me like the Premier wants some answers.
When we have the auditor, we have the coroner, we have the police, we have an independent commission, I'll tell you, there won't be a piece of dust on the floor that they aren't going to be inspecting.
Now, the industry group that represents these facility operators says the answers are really pretty clear. Need more personal protective equipment, need more access to rapid testing, need more money to fix up the facilities, and need more flexibility when it comes to staffing scarce resources. Donna?
David, there are problems to varying degrees in care homes right across the country. Is there a role for the federal government and national standards?
Yes, I think there is. In fact, there was quite an appetite for that here in Ottawa today. Parliamentarians were talking just exactly about that, saying that Ottawa should set guidelines and regulations for facilities right across the country. We asked the Prime Minister about that, but today he was not prepared to set himself towards any particular course of action.
There will be many important discussions going forward on how we establish a better system in Canada. And I'm not going to, short-circuit that conversation by putting forward aggressive proposals right now.
Now, I can tell you, Donna, that this crisis in our long-term care facilities is going to be at the top of the agenda when the Prime Minister and the Premiers have their weekly teleconference call tomorrow evening.
David Akin in Ottawa, thank you.